That's lightning fast. So when you get your hands on the latest tech, don't forget to do the right thing with your old devices. Recycle them. The Consumer Technology Association and its members are making recycling your old tech device as easy as purchasing new ones. Just go to greenergadgets.org, type in your zip code, and you'll instantly find the responsible recycling location closest to your home. You'll also find lots of tips to simplify your recycling, like asking the store where you buy your new TV if they'll haul away your old one. Television sets, video game consoles, smartphones, tablets. They're all recyclable. Don't let them clog up your local landfill. Just visit greenergadgets.org. You're sharp enough to get the latest tech tools into your home. Now be responsible enough to get your old devices to the recycler. That's greenergadgets.org.
90.3 WHPC.
Welcome back to Your Family's Health. This is Dr. Janine Cook-Garrard, and I'm along with Professor Marilyn Hendricks. And we're welcoming back our guest from a break, Joe Reynolds, and he's talking about self-injection. Welcome back, Joe.
Hi, thank you.
So, Joe, before we went on break, we were talking about, just to recap, about the onboarding process, and you mentioned about that it can be done in the home and the physician's office. So, Joe, getting back for safety, because I just want to talk about how we can make sure that we can convince our audience that this is really a safe device. Sure. So tell us, why is it important for self-injected training device to appear and function as realistically as possible?
Sure. Well, safety is definitely a high priority for us. And when we think of training devices, one of the important attributes that's important to remember is that training devices are resettable and reusable, so patients can use them multiple times in their practice and onboarding. But there are two things that they don't contain. Training devices don't contain needles or liquid or real medication. So that's one of the key differentiators that we leverage to make sure that they are, that we consider patient safety early and often. Now, making sure that they are realistic as possible, that's important because we want to make sure that through training and onboarding that patients build the right behaviors and that we set the right expectations for them before they continue on in their treatment and use an actual device. The last thing that we would want to do through training is to confuse patients or introduce new risk into their treatment experience.
So training devices are becoming more and more necessary in the community as we see patients are in the community and are still dealing with chronic illnesses. So with this particular training device, particularly for injections, are there any other kind of devices that can be used, like inhalers for patients who are receiving inhaling kind of drugs for asthma or COPD, chronic obstructive pulmonary disease?
Sure, absolutely. And all of those that you just mentioned, inhalers, yes, training is very important for inhalers as well. There was a study that came out around 2 years ago from the University of Texas that found that 93% of patients made mistakes when using inhalers. So there's a very large need for proper training and onboarding to inhalers as well. And even outside of auto-injectors, there are other forms of injection drug delivery with syringes or injection pens that it's very important to have training to support. And we're starting to see more on-body devices launch into the market. These are devices that are used to administer a larger volume or a more concentrated medication that require patients to adhere them to their body for 30 minutes up to several hours or even days, depending on what the treatment is. So all of those different types of drug delivery do require training and considerations for promoting safe use by patients.
Joe, I'm wondering, for a certain segment of the population in the community, particularly those that have dexterity issues or challenges, how are the self-injectors good for this population of patients who cannot otherwise use both hands or may have a sensory deficit, vision or touch? So how do they factor in, and do they meet the need of this population of patients in the community?
Sure. Well, our development process, the foundation of it is really the needs of our patients. So we like to define all of those attributes early on in product development and prioritize those requirements to really guide our creative process. And to help patients that may have limitations, we often incorporate technologies, whether they are talking features or whether they are sensors, into training devices to help patients that may have limitations or barriers. Some of our training devices leverage multiple psychology theories in order to increase retention and recall of training. So we have a lot of different approaches that we apply on a project-by-project basis for patients of a specific segment or population.
So basically you're saying that you provide the training during the onboarding process until the patient is ready. So for our listening audience, Joe, tell us, is there a limit and how often a patient can utilize the trainer?
Mm-hmm. Well, we like to encourage patients to use training devices until they are confident in their ability to use their real drug delivery systems. For some patients, that could be a few days or a few weeks, whereas other patients like to use a training device before each injection just to go through it, minimize anxiety, make sure that they're comfortable with the process, and to use their own device. So it depends patient by patient, but we do typically see our best results when patients can practice multiple times and have a training device to reference as needed throughout their treatments.
Do you have any kind of feedback from patients who are using these self-injectors, particularly anecdotes that you have received, positive, or negative, as to the use and their satisfaction with the devices?
Well, we certainly love to hear from our patients and our healthcare providers. It's commonly one of the most rewarding things that we do at Noble is when we get feedback from our users. And some of the things that we've heard over the years are stories of patients that were prescribed a self-injection device, but they didn't know how to use it. They weren't confident enough in their ability, so they had to go to an infusion center or they had to visit their healthcare provider in order to get their medications. And we found through those users that by introducing them to a training device and letting them use that to build confidence and reduce anxiety, that then they felt comfortable with self-injection. So rather than going to a infusion center or the healthcare provider, they became more autonomous and empowered in managing their treatment. So it's great to hear from patients, and we always like to take that feedback and use it to innovate and identify new opportunities that we can support with our core competencies and our development process.
So, Joe, looking at the entire process using this order or the self-injection device and the program that you have set up to make it work, tell us, how do you think these training devices help healthcare providers today to better serve our patients?
Well, we like to always think about our healthcare providers as well. And our goal with training devices is to help healthcare providers become more efficient and then to help patients confidently manage their treatments at home. And we feel like collectively those benefits to all of the stakeholders produce a net positive impact in the market. So healthcare providers are more productive, they can see more patients, and then our patients themselves are more empowered and realizing the full therapeutic benefits of their medications.
So, Joe, do patients need to ask their healthcare provider for a trainer if they were prescribed such a regimen?
So we do encourage patients to ask their healthcare providers for training or demonstration devices. And in addition to that, we like to encourage our patients to also reach out to pharmaceutical manufacturers. That's another distribution channel where patients can access training devices. And many of the products in the industry also have a lot of other patient support services that are very helpful to patients within these populations. So we encourage them to take advantage of those as well.
Joe, do you find that more and more drug companies are opting to develop trainers for their injectable drugs to help patients with their anxiety relevant to self-injecting?
We do. We have seen a lot of growth in the training device market, and a lot of it is from patient and healthcare, the benefits that training devices provide to patients and healthcare providers in the industry. And we expect that to continue as more patients are self-injecting and as new devices and novel therapies continue to launch in the market.
So, Joe, tell us, how can the listening audience contact you relevant to this device? How can they get more information?
So the best way to get more information on our products and our organization is at our website. It is www.gonoble.com, and we have a number of resources there on training devices and our organization, as well as some contact information.
Thank you, Joe, for being with us. We want to thank our guest, Joe Reynolds, for being with us, talking to us about self-injection. And we want to thank you, the listening audience, for tuning in to Your Family's Health.